Hi, my name is Dr. Stephen Stokes. Welcome to the channel. Today I want to talk about high blood pressure. Yesterday I had a lovely meeting with a client. His name is Bill. He was very concerned about his blood pressure, which is getting higher and higher. And Bill's already on a prescription medication for blood pressure. And his doctor has now introduced a second medication because his pressure is, quite frankly, still going higher and higher. And he's very concerned about this. This is a very valid concern. High blood pressure can lead to a dangerous situation where you're more susceptible to stroke and other problems, right? It's not good to have all that pressure in the cardiovascular system. So Bill is looking for some ideas, maybe some ways to help lower the pressure more naturally. I think ideally he would like to get off the medications, but I stressed, that is not the immediate concern. We have to get the pressure down. Once it gets under control, he can work with his physician to fine-tune the treatment approach. But for now, we're interested in trying to get that pressure down. And I wanted to emphasize to him that, in my opinion, there are three main reasons why we have high blood pressure. The first reason is when there is injury in the system itself. So if we have injury to the heart, or injury to the blood vessels, or injury to the kidneys, right? Even injury to the liver, these things, because it's all connected, can create a storm within the body where the blood pressure increases. And a lot of times that blood pressure is increasing because the body needs it to increase in order to fulfill basic functions. Really important to understand what I'm saying with that. The second reason that blood pressure can increase has to do with stress hormones. Of course, I see this perhaps most of all, especially in the way we live today. When your body is producing a lot of stress hormones, it keeps you in that sympathetic state where the blood vessels are constricted, and that extra pressure creates hypertension. And so obviously, if you have a problem with stress, that has to be addressed in order to overcome hypertension due to stress hormones, right? Similarly, if you have injury to your kidneys, that is something that needs to be addressed. Thirdly, a lot of times people that have, hypertension and are experiencing a situation where their blood pressure is shooting up, it has to do with what we're exposing ourselves to from the environment. This can be toxins. I remember I had a case of a person with chronic high blood pressure, and they worked for a pest control company. So they were spraying, bug killer all day long. And they were, of course, getting this into the system. It can be something like that with a toxin, or it can be the number one cause in your diet, right? Salt. Most processed foods are saturated in salt. Most people don't realize that salt is everywhere. It's in bread products. I had a client who was taking these hydration drinks. They had a little packet. I forget the name of it. It starts with an L. It's like LMT or something like that. They were drinking these little packets and dumping it in their water and drinking a couple a day. Well, each one of those packets had over 600 milligrams of sodium. So they were getting like close to 1,500 milligrams of salt a day in addition to their diet from these hydration drinks. Man, it's too much if you have problems. If you're sensitive to high blood pressure, it's way too much sodium. I like to keep my sodium at that level total for the whole day. So we have to also understand these three mechanisms, right? Injury to the organs, stress hormones, diet and environmental toxins. These make up a gestalt of trouble as far as getting hypertension. Now, if you have the hypertension already, you have to get it down, as I mentioned, and I have a few products that work really well for that. The number one is garlic, and I recommend Garlic Forte. This is by MetaHerb through Standard Process. This is the garlic product available in the entire world. This is the best garlic product available. This will lower blood pressure in about 10 days. In about a month, it'll really stabilize it down by about 20 to 30%. There's a lot of research that you can look up on garlic, but this is the best extract that I'm aware of currently on the market. You take 2 of these per day, and it's going to do a couple of things. The mechanism by which garlic works is pretty interesting. First and foremost, it increases nitric oxide production in the body. And this is a way that the blood vessels dilate. They relax, they open up. And this is a common mechanism you're going to see with garlic. So it opens up those blood vessels, which decreases the pressure in the vessel. Another thing that garlic does has to do with hydrogen sulfide, right? This is a gaseous signaling molecule, and it causes the smooth muscle of the body to relax. And that's primarily what we see in the blood vessel walls. So again, this promotes vasodilation. If you think about it, a garden hose, if you step on the garden hose, you get a lot more force as opposed to if you just let it relax on the ground, or if you put your thumb over the top of the hose, you get a squirt. Same idea, we want to relax those vessels. A third amazing thing with garlic is that it's an ACE inhibitor. And this is the same mechanism by which a lot of prescription blood pressure medicine works. And this is garlic is a mild natural ACE inhibitor. And this reduces the formation of angiotensin, which is a vasoconstrictor, right? So again, garlic is going to basically relax the pressure in the vessels, bring the blood pressure down. It's a great product. Another thing that garlic does is it prevents the platelets in your blood from clumping together. When those platelets clump together, it creates obstruction in the vessel itself, and that can also increase blood pressure. Plus, garlic is an antioxidant, so it's also going to help remove some of those toxins that we talked about. If you have those in your blood, and most people have at least some toxins in their blood, even if you're not working for a pest control company, you may have some. Again, garlic is phenomenal for that, and garlic also works really good with the gut, which is a whole separate topic that we'll talk about maybe at a later time. So garlic is the number one. Now, garlic is a herb, which means we take it short term. We don't want to take it long term. It's got a drug-like effect in the body. We have to be aware of that. So it's potent. It does the job, but it's not something we want to take long term. I always like to mix a herb or an herb with a whole food concentrate. And there is one that Standard Process makes. It used to be called Cataplex G, and now it's known as B2 Cataplex. And this is a combination of nutritional yeasts, brain tissue, heart tissue, liver tissue that's compressed together in a food concentrate. This is going to provide you with natural B vitamins, which are very effective in dilating the blood vessels again. In particular, if you take this product, you will normally see a response within a few days, but you have to take a lot of it because, again, it's like eating food, right? When we take an herb, we only have to take 1 or 2 pills. When we take a food concentrate, we have to take a lot of it. Because just imagine how much of the product, how much liver you would have to eat, right? And this is concentrated, but you still have to take a lot of it. So I will tell a patient to take 2 to 3 of these 3 times a day. So anywhere from 6 to 9 of these B2 Cataplex a day. That's really going to work at lowering blood pressure, again, from a food concentrate perspective as opposed to a medicinal herb perspective. And so with B2 Cataplex, we can take this long term. This will be the go-to long term for patients after they have the initial experience with the garlic herb. Also, most people are deficient in magnesium, unfortunately. Something like 30 or 40% of the population don't get enough magnesium. So there's a good chance that you're also deficient. And if you are, I recommend taking magnesium lactate. Relaxes the whole system. And if you're deficient in magnesium, you're going to see so many other benefits. Benefits sleeping at night, benefits with tight muscles. Magnesium is a go-to product. And the one that I like is magnesium lactate by Standard Process. Again, I'll have people take anywhere from 3 to 6 of these a day, spread out over the day. Works really well. If you have that deficiency, there's like a 40% chance that you have it. And if you do, you're really going to like magnesium lactate. Now, we talked about injury to the different organs. Obviously, if you have a heart injury, you've had a heart attack or something, you have to address that. Hawthorn is the best way to do that. If you have stress hormone problems in your body, Valerian complex is a good way to take care of that. And so there are other avenues to go down once you get this stabilized. But initially, we just want to get the numbers down, right? We just want to get your numbers in a safe, comfortable zone. Garlic and B2 Cataplex with maybe some magnesium. That's the formulation. That's the recommendation. If you want to get these products, use the links provided in this video. If you have any questions, you can contact me directly. Free consultations. You can text me on my phone, 239-645-2405, and we can talk about it, right? But Bill was very happy with this recommendation. He's going to try those and get back to me in about 2 to 3 weeks. Let me know how he's doing. I'll update the video. And I just want you to know that if you're suffering, there are tools that you can use to get your body to help heal the problem. This stuff does work, but it's like everything else. You have to work at it and you have to do it smartly. You don't want to just abandon a medical approach that may be keeping you from having a serious problem like a stroke and then go all natural. You want to blend these together and you want to use an experienced physician like myself with over 20 years of dealing with these types of cases with patients. And first and foremost, right, when I look at a case, it's always safety first. Safety first, and we want to minimize transition and minimize side effects. Hope this video spoke to you. Please subscribe to the channel. I'll see you again in a few days. Thanks for watching. Bye-bye.